Welcome back to the Empowered Learning Podcast. I'm your host, Andy Bennetts, and today we're diving into a topic that affects so many of us, chronic pain, and why the traditional approach to treating it might be all wrong. My guest is Dr. Fawad Mian, a board-certified neurologist and expert in regenerative medicine. But more than that, he's someone who has lived through the very pain that he now helps others heal from. After multiple injuries and disappointing results from surgeries and steroid injections, Dr. Mian discovered an entirely new approach to healing by helping the body regenerate, not just cope. If you've been told your only options are pills, surgery, or just living with it, this conversation is your wake-up call. Get ready for a hopeful, empowering conversation with someone who's walking proof that healing is possible. Dr. Mian, it's so nice to see you. Thanks for joining me today. How are you today, sir?
Very great. Glad to be on today.
Excellent. Appreciate your time. So lots to talk about. We'll dive in here in a second, but I want to just get some people drawn into this conversation that we're about to have here. So you share many patient transformations throughout the years, and I would love to hear what is one story that still surprises you or changed the way that you see what is possible in healing, whether that's physical, emotional, relational. What's one story that still stands out to you?
Oh, there've been so many, but I'll just
Right.
share one that I've commonly shared in the past is that we did have like an individual who had a really bad shoulder. He was in construction,
Okay.
um, kind of came in with headaches. That was
Mm.
what he actually came in for. It's because
Okay.
of something that actually was unrelated to his shoulder issues. And as a neurologist, I was trying to fix that part, but we found out that he inevitably had a bad shoulder. We MRI'd his shoulder. He had some tears within some of the tendons and some cartilage, and he was told that he needed surgery.
Mm-hmm.
And so it took a little time going through some physical therapy and some other treatments, but he wasn't getting any better. And ultimately, we discussed doing some of the regenerative treatments in our office, such as platelet-rich plasma, or PRP, as it's
Okay.
colloquial called nowadays.
Mhm.
And we did one treatment on this individual, and he was about 80 to 90% better after one treatment, which
Wow.
was actually quite surprising because I thought we actually need to do much more, maybe stem cells on him.
Mm-hmm.
And he did quite well. And, he had to use his arms for his livelihood, his hands and his arms.
Right.
So without being able to do that, I mean, that would have obviously, caused major ripples and issues in him financially. And it obviously
Absolutely.
takes an emotional toll on you as well, especially when you're trying to provide for your family. So he had a good outcome, and we've had plenty of outcomes like that too as well over
Right.
the years.
Yeah. Yeah. And like you said, I'm sure there's many others that are along the same lines, but that one stands out to you. So thank you for that. I appreciate that.
Yeah.
So Dr. Mian, I would love to hear a little bit about your background, kind of what led us to the point where you and I are talking today here on a beautiful Monday morning.
Yeah, absolutely. Yeah, so I mean, for me, I'm a board certified neurologist, and kind of what I got into some of the regenerative medicine that I've been doing now for the last 13 years, or going on 14 years, I guess now, losing track. I kind of went through a lot of my own aches and pains.
Mm-hmm.
Originally, I had actually injured my shoulder when I kind of let the weight slip, and when I was doing something called shoulder shrugs, and I injured like the small joint, kind of that you would feel like in the front of your shoulder over here, called the AC joint.
Okay.
I was pretty miserable with that, a lot of pain.
Right.
I went to the orthopedic doctor, and the first thing he said to me is maybe we can actually shave off part of the bone,
Mm.
or maybe get a surgery out of you. It's not something that I wanted to hear, given that I'd actually
Mm-hmm.
had failed some surgeries in the past already. So I kind of muddled along, lived in pain, had gotten some steroid shots, made the joint worse ultimately. At the same time, I was also getting some foot and ankle issues that kind of just cropped up out of nowhere. I was living in New York and doing training there prior to that, so I was walking around quite a bit. And I mean, hobbling around wearing Frankenstein shoes.
Mm.
Family members like, you look like you're 90, not doing very well, a lot of
Yeah.
pain. Eventually started affecting my knee, and my knee on the left side, I had torn my ACL back in 2001, doing sports related activities, and I had surgery on it. I thought everything was fine, but when my knee started to hurt again, because I was compensating for a bad foot,
Mm-hmm.
I basically had gotten an MRI, went to another orthopedic doctor, wasn't really paying attention to anything, and wanted to actually put a scope inside my knee.
Mm-hmm.
I don't think he even looked at my MRI at that point. And lo and behold, that ACL that was theoretically repaired was really not together anymore.
Mm-hmm.
So the graft wasn't put in the right way. And
Yikes.
so between my shoulder, my foot, my ankle, I also had like a bad Achilles after getting a couple of steroid injections in my foot.
Hmm.
I had like no alternative but either surgery or medications. And I didn't want to do any of those because those
Hmm.
can certainly take a toll. And for what I do, I really have to be on top of what I do,
Right.
especially even doing other procedures too as well. So I stumbled on something called prolotherapy years ago, and I searched out for that, and that actually was just actually taking a called like a sugar-based solution that actually, when injected, causes a local inflammatory reaction in the tissue.
Okay.
And that basically, what that really means is it starts stimulating healing. So
Mm-hmm.
it's like a controlled fire, so to speak, and that started helping.
Okay.
Eventually, I had gotten into platelet-rich plasma or PRP. What that is basically when we take your blood out, we spin it down, we concentrate the growth factors within the platelets, which are a component of the blood. And to make a long story short, we'll use some image guidance to inject those back into the areas of damage. So for me, I had to, I got that done for my Achilles, the plantar fascia, which is some of the tissue on the bottom of the foot. The Achilles is the tendon on the back of the heel.
Mm-hmm.
And those took a couple rounds to get better. For my plantar fascia, which is the bottom of the foot, it took a couple rounds because the steroids had done some damage to that. For
Mm-hmm.
my shoulder, I actually had to do several rounds of PRP and prolotherapy because the two steroid shots I got in here made my joint look like a dog was chewing on it. That's how bad the joint looked like. And ultimately, with my knee, I kind of had to just do treatments on supporting structures of my knee. I still don't have an ACL because I like to think that maybe I can kind of hold out for something where it could be something as simple as injecting something with inside the knee and then tissue goes where it needs to go. This is more science
Mm-hmm.
fiction. That's not real right now.
Right.
But I'm not going to undergo another knee surgery right now because I know that's going to
Yeah.
cause more arthritis. It limits me in terms of doing certain physical sports and things like that I would like to do. So,
Gotcha. Okay.
but long story short is I actually was able to get out of a lot of chronic pain ultimately,
Mm-hmm.
and was able to go back to doing other exercises, lifting weights. It's something that I implemented in my practice in 2012. And we've been doing it on patients ever since. I've also treated multiple family members too, as well,
Mm-hmm.
who were, skeptical at the time of me doing this, and they were quite surprised with how the things turned out ultimately. And so we find a huge benefit in terms of being able to think outside of the box and treating things. So
Right.
as I mentioned before, the guy with the headache,
Mm-hmm.
really the main issue wasn't so much the actual headache itself. It was just the fact that it was a bad shoulder that was causing the problem. So we see a lot of these downstream effects from chronic injuries in people.
Sure. 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 That is very interesting because I'm reading through your bio and different things like this. I think that people just expect or yeah, I guess expect is the right word for doctors to kind of to go through these routes and not that any of them are not caring and trying to do their best, but it
Right.
seems like you've really kind of gone down a different route rather than kind of the standard like, okay, here's the pain, let's fix that. It feels like you are a little bit more, and I come from a teaching background. It's like what is
Mhm.
the root cause, right? Where did this go wrong back here? Let's talk
Mhm.
about that. Let's get this addressed rather
Mhm.
than dealing with the subject at hand at this point or the pain, right?
Yeah, I mean, I think it's also just the way in Western medicine how it is,
Mhm.
and unfortunately, unless you start going the more of the holistic route, is that it's
Right.
always worried about the end product of everything, not so
Hmm.
much, how you got there.
Right. Exactly right. Yep. So, I mean, and I was going to ask, a question about your turning point to kind of turn that, but you've kind of already presented your whole use case of the fact that you dealt with this as a uh, not a subject, but as a what is that
My
called?
own patient.
There you go,
Yeah,
patient. That's what I know. As a new start
yeah,
with you started as a patient and
yeah.
realized that this is a much better holistic option as well. And you mentioned that steroids had done damage. I never knew the fact that doing steroids and that kind of stuff would do damage to your ligaments or to your bones and that kind of stuff. That's new news to me. I didn't know that was a thing.
Yeah, it's something that many people are unaware of,
Mm-hmm.
and it's commonly done, obviously, in joints and everywhere in the body,
Mm-hmm.
the spine. But there's research and data shows that it's actually toxic to your
Mm-hmm.
bones, your
Right.
ligaments, your tendons, cartilage. I was looking at a research study, I think came a couple of years ago, and it actually looked at the cartilage thickness, and actually it was significantly decreased
Mm-hmm.
after injecting steroids in there. There was one study that actually looked at folks who went to like a knee replacement, and the two groups were basically people who didn't get steroid injections and people who
Hmm.
did.
Hmm.
And so in the people who did, there was about a 35 to 40% increase in knee replacements, as
Hmm.
opposed to people who didn't get steroids at all in their knee and try to
Interesting.
deal with it like another way. So you think of the treatment that actually was trying to give you some benefit actually ended
Right.
up causing you to have a surgery down the line.
Interesting.
So yeah, it's quite interesting. And even people who get epidural injections,
Hmm. Yeah.
these are the steroid injections you get in your spine that go around the nerve.
Hmm.
Um, all well and good. Doesn't address actually the true underlying issue per se, but gives you relief
Hmm.
to a certain extent. Um, but it's been shown that folks who are getting older, and also particularly in women as they're getting older, who have less bone mass and um, decreased mineralization of the bones, that they have increased risk of fracture with
Okay.
each subsequent injection. So they actually
Sure.
limit it.
Yeah.
And if you inject a steroid into a tendon, it naturally just eats it away. I've
Mm.
been proof positive in injecting my joints from when I didn't know, and I was able to
Hmm.
see that, look, it actually caused damage to
Yeah.
my
Wow.
joints.
That's crazy. Interesting. Okay. Well, learning all kinds of new stuff today.
Mhm.
Um, yeah, so you frame pain not as just something to treat, but as really a signal that something else is wrong underneath. What are some of the most common signals that people miss, especially when they're managing their pain and not healing it? And what should we be looking for those signals to treat again the root cause rather than just the pain at the end of it?
Yeah, I mean, I think one of the common things and some of the common misnomers are, people who are people who you have an injury or you have a little ache and pain, and
Hmm.
the natural thought process, okay, let me rest it, let me put
Hmm.
some ice on it, let's take a little pain reliever, and let's see
Right.
how it goes.
Right.
And if it's something that's not really getting better within a matter of a couple of weeks, then it's
Right.
likely to be an injury that really needs to be addressed. But then part of the problem of that is getting adequate medical care for something like that.
Mhm.
And unfortunately, it's just human nature. We're not necessarily as proactive as we should be in terms of
Mhm.
our health in general. So we
Mhm.
kind of let things fall
Right.
by the wayside until it gets so bad that now, even if you did whatever treatment you're doing, it's going to require a lot more to
Mhm.
try to get you better ultimately. And so
Right.
I think the biggest thing is being able to be proactive about things. Also, if
Right.
you're getting any numbness or tingling or any
Mhm.
like function that's getting affected by all of this, I
Mhm.
think those are also big things and flags that you really need to address. And a lot of
Mhm.
people, again, sometimes they'll say, let me just wait it out and see what happens.
Mhm.
Waiting's all well and good, but if it's something again that's lasting several weeks on end, the likelihood of you
Right.
really improving ultimately down the line is a lot less. Now you may
Mhm.
get better even after a longer period of time or whatnot, but inevitably the problem is kind of like a roller coaster where it kind of just comes and goes until finally it just
Sure.
hits that point where things reach a nadir and you're really in excruciating pain. And unfortunately, we
Mhm.
see that quite often with a lot of
Right.
people.
Yeah. Do you find as a practicing doctor that and I'm sure it's probably a myriad of reasons, but what would you say is kind of the split between just ignorance, not knowing what to do, um, I don't know, just stubbornness. I know I think probably guys are probably worse than this with than
Mhm.
men than women, but like just like it'll get better. I mean, you mentioned that, just hey, we'll do this thing to kind of make it
Mhm.
get better. And then the third one is just the cost, right? I think people are just so concerned about
Mhm.
yes, I know I need to do something, but I've got bills stacking up and this kind of stuff. I work with people on finance stuff, and I've
Yeah.
been shocking to me how crippling medical debt can be, and how quickly people can go into bankruptcy just because of medical procedures and different things like that. What mix do you think of those three aspects of just being stubborn, not knowing, or just medical things are keeping people from taking on these things in a more proactive manner?
Well, I definitely think all of the above. I mean, male, being, as males, we're definitely the worst offenders of it.
Mhm. Right.
We tend to be less in tune for things and we're more likely to let things slide ultimately.
Sure.
So there's that, and that kind of leads into that stubbornness ultimately.
Mhm.
Um, for some people, it really can be ignorance, but it's just because there hasn't been enough education. And not all doctors are not very educated about this.
Right. Right.
And so that becomes also part of the problem. And so then it's business as usual. most places. And, there are obviously constraints within the insurance model of what we do.
Sure.
So
Yeah.
it's not like, everything, the folks who run these organizations are the most altruistic people. It's really a
Mhm.
business at the end of the day, and they
Mhm.
got to see what's
Mhm.
cost effective, right?
Right. Right.
And so there's that. And then when you come into the area of cost, well, here's the thing that I think sometimes people don't think too much about is that when it comes to the insurance company about, because you always get asked, is this covered by my insurance?
Mhm.
That's a loaded question because what's covered by insurance now is very different than it was even like 10 years ago or 20
Right.
years ago, right? A
Yeah.
lot of things used to be covered by insurance in totality.
Mhm.
Now it's okay, what's your copay? What's your deductible, out-of-pocket max, um, co-insurances, all these things. And I think a lot of people don't have the concept of that thing. And so, God forbid if somebody really gets sick or really injured, then that's kind of when they hit those costs. And the hospitals are charging exponentially higher than what you would actually get charged if you were going to like a private doctor and whatnot. So the costs are not as transparent is really what I'm trying to get at. And
Sure.
they hide it away quite well,
Mhm.
to be quite honest with you. Um, and so that's part of the problem. When we do what we do, obviously there can be a little bit of a cost barrier, but we can always do payment plans. But
Mhm.
the cost of what we do is always going to be something that's going to be transparent to the person.
Yeah.
There's
Yeah.
nothing hidden beyond that. And so sometimes that's kind of harder for people to see that when they see see those kinds of things versus, well, my insurance I mean, they don't cover the stuff that I do here on the regenerative side, but in terms of covering other things that one would think they would cover, it's going to be a surprise a lot of the time, and you'll be surprised at what hits your deductible, how much they
Sure.
are, and so it becomes quite challenging.
Right. Why, and I mean, you kind of mentioned it, but why do you think there are so many restrictions on what is covered and what is not covered by insurance? Because and again, this has been years ago, but my wife had some things that she had gone to doctors, and this was probably 20 years ago,
Mhm.
and had tried over and over and over, and is it a stomach thing? Is it a this, right? And really, again, Western medicine didn't have very many answers. She started doing some holistic things, and that
Right.
made a massive difference. But if she had pursued the holistic route or the Eastern medicine, that kind of stuff, that would not have been covered. Again, I don't know if there's a straight answer for that, but why is it that Western medicine stuff is covered and holistic is less so? Maybe that's changing. What are your thoughts on that?
It comes down to dollars and cents,
Yeah,
unfortunately.
yeah,
Like I said, I mean, sometimes I just make the joke about it. It's not like the people at the head of these insurance companies are like three wise men around the manger kind of thing that are like really
no,
nice, good people who are trying to do
right.
something for your benefit. Really, it's like, I mean, they got stockholders.
Sure.
They got to give out their dividends and they got to make some money. And so that's really what it boils down to. So I just give you an example. For instance, they're more than willing to pay for things like narcotics, which are quite addictive, or amphetamines. But if you had to give somebody another medication that didn't have those side effects or whatnot, then it's cost an exponential amount of money. And the companies that produce actually these medications also
Mhm.
are charging exponential amounts for these things too as well.
Wow. Yeah, I mean, I was hoping that was not the case, but I think that's probably what a lot of people are kind of um, suspicious of is that,
Mhm.
our businesses, and to your point, insurance companies and maybe even some government agencies and that kind of stuff, are they making decisions based on what is best for the person or best to line their pocket? And unfortunately, it seems like many times um, those decisions are not based on our benefit, but their own.
Right. Pretty
Yeah,
much,
yeah,
unfortunately.
yeah. Well, I wish we could fix that. I don't know how much we can do. I guess to your point with in your you mentioned transparency. I think that is very, very true. I've been the recipient of those bills. It's like how in the crap did this
Mhm.
small thing blow up into $1,000 plus when it was like a 15-minute conversation, right? So
Mhm.
I appreciate the idea of like, hey, it's going to cost this. It's not going to cost more. Here's the breakdown. I mean, think of it kind of like a um, when you go to the garage, right? It's like, hey, here's the labor, here's the parts. I mean, this is what it's going to be, but there's not
Mhm.
surprises on the back end. I guess what are you doing in your practice outside of transparency to kind of combat that aspect of, we are in this for people. Yes, we need to make some money, but we're not trying to gouge people and keep them
Mhm.
from from positive things just to line our own pockets.
Yeah, so I mean, well, first of all, one of the things that I'll always do with anybody, I'll try to meet them with where they're at, and I'll
Hmm.
give them the honest answer what I think they should do.
Yeah.
And sometimes it may require simply just minor things. Maybe they don't need the regenerative treatment. Maybe for them it might really be like the physical therapy, maybe a little bit of
Right.
acupuncture, or maybe some
Right.
supplements here and there. But for the people who do need it, we do again we have like payment plans for people that we put out there too as well.
Hmm.
We obviously always talk about the merits of what we're doing. Some of
Hmm.
these regenerative treatments may be combined with other modalities of treatment, which are off the
Right.
beaten path too as well, to try to really
Right.
help customize and get things to where you're actually going to get like a huge benefit from it, as opposed to another procedure that they may do through the insurance, which is going to be
Hmm.
more destructive and
Sure.
inevitably being more costly. So sometimes this is a hard conversation to have,
Yeah. Right.
and can be quite difficult. I mean, I can think of like, a company that does this extremely well. I think is Apple actually.
Okay.
So right, because if you go look at the Apple phones, you get like the Pro Max or whatnot. I mean, I know they're different price ranges. It's a
Hmm.
$1,500 phone,
Right.
right? And so, but they're able to put it under a finance where you're financing it over
Mm.
2 years, and then they say, hey, let's get a new phone, and they keep making you
Hmm.
get a new one every year
Yeah.
or
Right.
2 years or whatever or whatnot. But
Yep.
they're able to like try to make it where it's a bit more palatable for people, and
Mhm.
that's one of the reasons why they do it so well.
Sure, 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 sure. No, I agree. I agree. Let's shift gears into technology. That's kind of my background is education and in technology as well.
Mhm.
Looking ahead, what role do you see AI, wearable technologies, diagnostics, any of that kind of stuff, specifically for managing pain or avoiding not energy, surgery, rather to say. Um,
Well, I think that it's still a lot of this stuff is in its infancy. Right now,
okay.
I think medically, I think there are a lot of companies out there kind of jockeying for position to
Right.
look at things, but I'd have to say I think it's still to me quite nebulous in terms of how, for what
Mhm.
the very particular thing that I'm doing, how well
Right.
that's going to work out.
Okay.
With the AI, I think AI in general, just in medicine, I think is quite helpful because it's gathering up a lot of data. Even
Hmm.
then, there are certain AI apps will actually look at research and help you synthesize them.
Hmm.
Look at very specific articles. Not that there's not one platform that's been out there for a very long time that does that, but they're ones that actually are going to start doing it better.
Right.
Um, I think it's a little bit of a double-edged sword in terms for patients, because for those people who are a bit more tech savvy and then
Hmm.
running over to Chat GPT,
Right.
right? I mean, there's still a lot of people that don't.
Hmm.
And we see a lot of people, most people don't, but there's still some people that do. I actually had one patient find me based on Chat GPT, which
Really
was a first.
interesting.
Yeah, I'm sure there'll be more of that.
Hmm.
But I think sometimes there can also be misinformation. Sometimes
I'm
that's
sure.
out there in AI, and it kind of might lead you down the wrong rabbit hole. But I
Right.
think as more questions are asked, more information is put into the system, it's going to
Right.
eventually get better. It'll get learned and trained
Hmm.
better. And so I
Right.
might be able to help guide patients a little bit in terms of trying to say, hey, maybe I need to see this person, or I might need to go this route. So it might
Hmm.
help them get to a doctor so they can make a better educated decision. So I think
Right.
that I do see, in the realm of radiology. I mean, I'm not a radiologist, but I have a family member that is, and
Hmm.
it's helpful in terms of looking at things. And I think if you can kind of get to a diagnosis faster or looking at
Sure.
things based on a pattern, I
Right.
think at some point that's going to get very good at it and really help those radiologists ultimately.
Hmm. Right. Yeah, that's really good. Um, Specific to again, regenerative medicine, which is kind of your specialty at this point. What excites you as you look forward to the next 5 to 10 years? I mean, maybe that's technology, maybe it's just some other things. What gets you excited about that space?
Well, many different things. Like, I mean, we're using some technology now because we use certain we have used lasers. We use something
Hmm.
called shockwave therapy too as well. And the general premise behind these technologies is to help diminish acute pain and chronic pain.
Okay.
But they also stimulate cellular reactions. And so when you combine that along with regenerative treatments, if those are like autologous stem cells, being stem cells that come from you, or
Hmm.
PRP, that actually enhances the ability for that to do even a better job ultimately.
Hmm.
So I think there are going to be probably other technologies that are probably going to do something similar.
Hmm.
Um, I think the other thing that I think I think is also at least exciting to me, and it's a little bit of a controversial thing, and it's not something that's done in the U.S. is, There are certain IV stem cell therapies that are done, but they're done
Mm.
overseas because they're not FDA approved.
Okay.
And so there are clinics that have popped up in places like Panama, Mexico,
Hmm.
out in the Caribbean too as well. They're actually out like in the Middle East too as well.
Hmm.
And that's for trying to treat all sorts of conditions and people even just generalized chronic pain
Right.
and so I think that's something that with time, I mean, I don't know what point in the US that's going to happen, but I think internationally, I think that'll gather up steam probably within the
Hmm.
next 10 years. And
Hmm.
my thought is that that might change and move the needle ultimately for those things to be provided more in the US rather than it being a
Hmm.
clinical trial that's being done at a major university hospital.
Right. Right. Wonderful. I'm toying with asking this question. I don't want to get too far down on a rabbit hole, but would love to just get your take just because you're in this space. What role do you think that government entities, and we don't have to be very, very specific, but can you foresee new regimes of government coming in that will change the course of how we do medicine, or is it pretty much like because of the things we talked about before, because of the insurance aspect of things, do you see that shifting much, or is it pretty much like this is a business thing and we're going to have to kind of look outside of the United States for some of this stuff like this right there? Do you see any of that changing or getting better with new ideas and new kind of focus on maybe taking better care of the patients and less so worrying about the bottom dollar?
Unfortunately, I think the bottom dollar is going to rule the roost.
Yeah.
And it doesn't matter what administration is in power or whatnot. I think at least the current Secretary of Health at least is a bit more open-minded. I
Right.
think at the very least, so that allows maybe for more holistic treatments, and some
Hmm.
laws have actually changed in some states.
Hmm.
But as these different administrations change,
Sure.
we don't know who's going to come in there. We don't know if
Right.
things are going to go back to the way they were, or more
Right.
constrained, or is there going to be something more open-minded. But
Mhm.
one thing that I do know about like health-related issues and in our country is that things happen very, very slowly. And
Yeah.
it's very intentional about
Right.
that. Even like a new drug would take like 10 years to come out.
Hmm. Yeah. Yeah. No, I would agree with that, and I see that on a smaller scale in education, just trends and what technology in some aspects, but definitely just the change in mindset and theory. I mean, I've worked with a lot of military folks, and it's the difference between turning a speedboat and turning an aircraft carrier, right? It takes a long
Mhm.
time to shift gears and get into a different aspect of things. So wonderful. Well, Dr. Mian, I would love to ask you a few questions here that we ask of all of our guests. These are probably going to be a little bit of a surprise to you, but you're a smart fella. I'm sure you'll do just fine with this. So the three key questions that
Sure.
we always ask our guests.
Uh-huh.
Number one is, who is a leader that you most admire and try to emulate?
Oh, wait, that's a hard. That's a little bit of a hard question. I mean, I think
Mhm.
there's so many. I mean, I think there are a lot of great leaders. They all come with their pros and their cons.
Sure.
But if I took like a sports metaphor,
Okay.
I would use somebody like Phil Jackson,
Okay. Yeah.
who actually coached the Bulls.
Yeah. Yep. I
Uh,
know him
and,
well.
and and the reason for that is because
Okay.
he actually was able to put together some egos and
Yeah.
actually be
Right.
able to use mindset to really change their mind
Hmm.
about what they could accomplish.
Right.
And he did it not just with one team, he did it with two teams and
Right.
multiple egos. And so I thought that's pretty amazing. And so for me, what that tells me is that keep myself open-minded,
Hmm.
learn from new ideas, and know even
Right.
no matter how hard things may be, you can certainly find a way out of them and find a way where you're going to provide benefit to a lot of people.
Absolutely. I love it. I'm sure you've watched the Last Dance.
Yeah,
Oh yeah, my son's obsessed with that. We've watched it a couple times together. It's good stuff. So
yeah, yeah.
yeah, wonderful, wonderful. All right. Question number two. What learning? Again, this is Empowered Learning Podcast, which we've learned a lot today. What's
Mhm.
some learning that has most impacted you in the last year?
I mean, for me, it's actually doing some up-to-date stuff on what's going on, like in the regenerative world, and seeing what
Okay.
colleagues are doing.
Okay.
And so part of that also was the technology-based treatments that I just mentioned that I've
Mhm.
implemented in my practice. There's something else which I didn't talk much about, but I think eventually it'll be one of those things that kind of crops up out of the weeds here, but it's something called peptides. You may know it as, there are different types of peptides. They're just short chains of amino acids They're not quite proteins or whatnot, but a common peptide, for instance, or the GLP-1s or
Mm.
colloquially Ozempic, Mounjaro, and so forth. I think the peptides also are used for other things, for chronic pain, brain fog,
Mhm. Mm.
for cellular metabolism, things like that. And so I think
Mhm.
I've been reading a little bit more about that and trying to study it more and more. So it's something that I would like to implement in my practice because I could feel that can be like a huge difference in somebody who's
Mhm.
really suffering.
Yeah, wonderful. Okay, cool. All right, and the last question we have for you is, again, you can do this in your personal space. I guess we've talked mostly just professional at this point. What would you do to empower learning for future generations? What is a concept or a an area that you feel needs to be taught to future generations?
I think honestly, it goes down to critical thinking skills.
Okay, I love it.
Uh, the thing actually I kind of fear a little bit actually with the AI is that it kind of makes you a little I mean, not maybe not the greatest terminology, but it kind of makes you a little bit lackadaisical.
Absolutely, yeah. Yep.
And if
Yeah,
you overly rely on it for every single little thing, you
sure.
start forgetting things. I just give you the example of like, a GPS, for instance. Now they're in our phones, they're in our cars, they're everywhere. And even with phones, we have the cell phones. But back in the day when I was growing up, we would look at a map and see where you needed to go and figure out how you actually needed to drive to that place. With phone numbers and things like that, you actually
Mm.
were memorizing things. You knew them off the
Right,
top of
right,
your head. Now I barely, all I know is my phone number, my wife's, and my mother's. That's it. I don't know anybody
right,
else's phone number.
right, right. Yeah. No
But
need to.
if we could find a way to really just try to hone in on critical thinking skills. So I think, with AI-based learning, I think, one of the things that would be helpful in education, even like, whether people are in college, school, and high school, is being able to set up programs that actually help foster those critical thinking skills, no matter what subject matter it would be.
Hmm.
Rather than just try, pure memory retention and all of that too as well.
Right.
Because I think nowadays it's going to be a lot of utilizing AI for different tasks. But then on
Hmm.
top of that, you still have to have critical thinking skills on how to use the information from AI and use it in the right
Hmm.
way, because AI can still be wrong ultimately.
Right. Absolutely. Yep. Nope. I love it. Well, very good. Well, Dr. Mian, I would love to just give you an opportunity here. If someone is listening right now that has been dealing with chronic pain and just discouraged by failed therapies and just facing a future that just feels kind of stuck, right? We're going to be in medical appointments. We're going to be doing these surgeries, different things. What's one message that you want them to hear before they go?
Right. So you don't have to live in pain. Just
Okay.
because you're getting older doesn't mean that you've got to live in pain. There are ways to make yourself better, and there are opportunities out there, and there's a lot more information out there and a lot more modalities of treatment that are out there now that weren't before. And so all you got to do is look around a little bit, no matter
Mm.
where you are, and you can certainly find somebody that can help you really feel a lot better.
Wonderful. And we will put your information in our show notes there, but any specific place that people can find you when they're looking for you?
Yeah, absolutely. So I mean, they can find us at prolohealing.com. That's kind of where folks can get more information, also book an appointment too as well.
Okay.
And I also wrote a book on my own personal injuries and has some stuff on mindset and nutrition.
Okay.
It's on Amazon, pretty cheap. It's called Getting to Pain Free: How to Live Your Life Without the Need for Drugs or Surgery.
Pain free, and then Mian, right? I think if they search that, they'll probably find you. Yeah.
Yep.
Okay. Wonderful. Awesome. Well, Dr. Mian, this has been very, very educational and super nice to get to know you a little bit better and learn about all of the interesting, fun things that you're working on there. So thank you for your time. I appreciate it and look forward to getting this out to our audience and getting the good word out there. So thank you for your time, sir.
All right. Thank you for having me on today. I really appreciate it.
All right. No problem. Take care.
All right. Take care. Bye-bye.
Thanks for joining me for this eye-opening conversation with Dr. Fawad Mian. If you or someone you love is dealing with pain, I hope today's episode gave you a fresh perspective and maybe even a path forward. To learn more about Dr. Mian's work, regenerative therapies, or to request a free consultation, head to drmian.podvantage.ai. Don't forget to subscribe to the Empowered Learning Podcast, leave a review, and share this episode with someone who needs hope and a healing plan. Until next time, keep learning, keep leading, and stay empowered.